This is Roy. And Roy has never had to sell a single pill in his life to become one of the richest gorillas in the jungle. But Roy doesn't run a pharmacy. He doesn't make medicine either. Roy runs something called a Pharmacy Benefit Manager, or PBM for short, and his job is simple: stand exactly between you and the medicine you need, and take a cut every single time bananas change hands. Genius. Except things aren't quite so simple for the monkeys actually paying for their prescriptions. Because while Roy's take-home keeps climbing, the price of a simple insulin pen at your local pharmacy somehow keeps climbing right along with it. Here's the thing. Roy and his PBM buddies control roughly 80% of all prescription drug claims processed in the entire US jungle. According to the Federal Trade Commission's own 2024 report, 3 companies. 80%. That's not a market. That's a chokehold. So what does Roy actually do with all that power? He decides which medicines your insurance covers, negotiates secret rebates with drug makers behind closed doors, and then quietly pockets a slice of the difference between what a drug actually costs and what you're told to pay at the counter. The FTC calls this spread pricing. Monkey calls it financial bullshittery. The pharmacy middleman scam explained. So back to Roy's little rebate problem. Because here's how it works. A drug maker wants their insulin on Roy's approved list, so they offer Roy a rebate, basically a kickback, sometimes worth more than half the drug's sticker price. Sounds great for the drug maker, since a bigger rebate means better placement on Roy's coverage list. Except that rebate rarely makes it back to you at the pharmacy counter. Instead, Roy and his parent company keep a healthy chunk of it. According to the FTC's own investigation into the top 3 PBMs. And here's the part that should really make your fur stand on end. The bigger the sticker price of the drug, the bigger Roy's rebate. Which means Roy is financially rewarded every single time a medicine gets more expensive, not less. Read that again. The middleman, whose entire job is supposedly keeping costs down, actually profits more when costs go up. And the wildest part, Roy's parent companies don't just run the PBM. They also own the insurance company. And in many cases, they own the actual pharmacies too. So Roy is on every side of the table at once, deciding what gets covered, what you pay, and where you're allowed to fill the prescription, then paying that money to himself. Imagine playing a poker game where one monkey owns the casino, deals the cards, and also holds every hand at the table. That's not competition. That's a magic trick. And regulators have noticed. The FTC's own interim staff report specifically flagged this vertical integration as a structural reason why prices keep climbing, even as PBMs claim they're saving everyone bananas. Naturally, this setup has made Roy's parent companies some of the largest corporations in the entire jungle by revenue, sitting comfortably in the top 15 of the Fortune 500 list 2 years running. Meanwhile, independent pharmacies, the small banana stands of the medicine world, are getting squeezed out entirely. The National Community Pharmacists Association reports that over 1,000 independent pharmacies closed their doors in a single recent year, many citing PBM reimbursement rates that paid them less than what the medicine cost to stock in the first place. So the pharmacy loses bananas filling your prescription. Sit with that for a second. Your local pharmacist isn't gouging you. In a lot of cases, they're losing money just to hand you your own medicine. Because Roy set the reimbursement rate low enough to fund his own rebate empire. Before we keep peeling back the layers here, quick word from today's sponsor. Because staying informed about who actually controls the systems we depend on is exactly what this channel is about. Sponsor segment. Swap in your current sponsor's read here. Following the same beat, personal anecdote about why you use the product. 2 to 3 concrete features. Then the discount code and link. And now, back to the video. And this isn't some new hustle Roy just invented last year either. PBMs originally showed up in the jungle back in the 1960s as simple claims processors. Basically, paperwork monkeys handling insurance forms. But somewhere along the way, Roy realized that sitting in the middle of every single drug transaction in the country meant he could quietly start writing the rules of the game instead of just processing them. Decades of mergers later, And what started as a paperwork job somehow became one of the most powerful, least understood industries in the entire jungle. Most monkeys watching this video have never even heard the term PBM, despite one touching almost every prescription they've ever filled. Now you'd think, with margins that thin, someone would step in, right? Well, the FTC tried. In September 2024, they filed a lawsuit against the three biggest PBMs, accusing them of artificially inflating insulin prices for their own profit while patients paid the price at the pump. Quite literally in some cases, since some diabetic monkeys have reportedly rationed insulin doses due to cost. That's the human cost hiding behind Roy's spreadsheet. And insulin's just the headline drug. The same rebate mechanics apply across asthma inhalers, EpiPens, and a long list of medicines that monkeys can't simply choose to skip. But here's the truly dystopian part. Because, remember, Roy doesn't just sit quietly counting his bananas. Roy actively decides which cheaper generic drugs get excluded from coverage lists in favor of pricier brand name options. Specifically because the pricier option comes with a fatter rebate attached. A 2023 congressional inquiry found internal PBM documents showing formulary placement decisions were, in some cases, driven more by rebate size than by which drug was actually better or cheaper for the patient. Not a conspiracy theory. Congressional record. So the next time your doctor prescribes the cheap generic and your insurance mysteriously only covers the expensive brand name version instead, now you know roughly why. And it doesn't stop at formularies. Roy also runs something called clawbacks, where pharmacies sometimes get paid more for a drug up front, only for Roy to reach back in weeks or months later and pull bananas back out of the pharmacy's account, often without much warning. Independent pharmacy owners have described opening their books to find thousands of dollars quietly deducted after the fact. For reasons buried in contract language, most of them never had the lever IJ to negotiate in the first place. It's the financial equivalent of a gorilla handing you a banana, then mugging you for it around the corner. And because these contracts are often protected by strict non-disclosure clauses, most pharmacists aren't even legally allowed to tell their own customers exactly how the pricing on their shelf got decided, which means the monkey standing at the counter is often the very last one in the entire chain to find out why the bill looks the way it does. So what can be done about Roy? A handful of states have already passed laws banning spread pricing outright, and there's a bipartisan push in Congress right now to force PBMs to disclose exactly how much of every rebate they actually keep. The FTC's lawsuit is still winding through the courts as we speak, and if it succeeds, it could force real structural changes to how rebates get negotiated and passed on. But here's the hard truth. Roy's lobbying arm spent tens of millions of bananas last year alone fighting exactly these kinds of transparency bills. According to Open Secret's lobbying disclosure data, the train hasn't left the station yet on this one, but Roy's doing everything he can to keep it parked. And with that kind of lobbying budget, he's got a pretty good shot at succeeding. At the end of the day, every banana you hand over at the pharmacy counter is quietly funding a system where the middleman, not the doctor, not the drug maker, decides what medicine reaches you and what it costs. The question is whether reform actually catches up before Roy's slice gets even bigger, or whether this becomes just another cost of living in the jungle that everyone quietly accepts because fighting it feels impossible. No one really knows how this plays out yet, but if the FTC case goes anywhere, expect Roy to fight it every step of the way, with every lawyer and lobbyist his rebate empire can afford. And remember, this isn't just some abstract policy fight happening far away in a courtroom. It's the reason the price on the little sticker at your pharmacy counter almost never quite makes sense. And now, at least, but you know why. If any monkeys are confused, remember, this is just a simple explainer about how PBMs work and their impact on the jungle. It is not a hit piece or endorsement of any parties referenced. Please do not sue Monkey. Thank you so much for watching, and subscribe for more content just like this.